Hi, I'm Dr. Lynn. I'm going to show you how to use a soft silicone cup to do some of your own myofascial release in your abdomen. First, we'll start with some general techniques to release some common areas that people with pelvic health and abdominal concerns tend to have tension. We're going to be gliding the silicone cup after applying some suction. So it would be helpful to lightly moisturize the skin so that it's slightly slippery. Moisturize your rectus abdominis area, going from about the 5th rib down to your pubic bone, just on either side of the center line of the abdomen. Also, apply some lotion over your hip flexor area. So you're going to find the crests of your pelvis and then just follow that ridge down to your groin line, applying some light, just natural unscented lotion. Okay. Also apply some moisturizer right above your pubic bone across your bladder area. Cupping can help suction skin and superficial fascia upwards. Remember that those superficial layers are connected with little web-like fascial bands in different planes to some of the deeper structures like muscle and organ. So even though you might feel like this technique is very superficial, it can have a beneficial effect even deeper. First, we're going to go over cupping and gliding over the rectus abdominis. So I'm starting a little lower than my 5th rib. You could start a little higher if you undress a little bit more at home. So starting at the 5th rib, which is about level with nipple line, you're going to compress the cup, sort of smush it, press it down onto your skin, keeping that downwards inward pressure. You're going to then gradually release your grip so that it suctions the skin and fascia upwards into the cup. Then you're going to try to maintain that suction and then hold the base of the cup lightly and try to glide it downwards, but maintaining that suction. So don't squeeze it too hard. I'm just sort of guiding it. If you squeeze it again, you'll release the suction. So just nice and slow and controlled, and you can give it little wiggles, almost like a little steering wheel motion if there's a tight spot that you feel like it can't grip and suction very well. You're going to slowly glide it down to your pubic bone. Okay. You could also go the other way, and feel free to pause and apply more lotion if you feel like it's not gliding well. So if you were going to go from the pubic bone up, again, you're going to compress the cup, stick it down onto your skin just above the pubic bone, and then slowly, gradually work it up over that right side of your rectus abdominis, trying to maintain that suction, and just taking note if there's anywhere that it easily pops off, that might be an area to pause and do a little bit more treatment. So say if I had some scar tissue from some abdominal surgeries right here near my belly button, and I found that every time I glided over that area, I couldn't maintain the suction and it just popped off. Then I would compress the cup, stick it down over that tight area, suction up the tissue as best I can, and then I would stay in that spot instead of gliding. So I'd turn it back and forth like a steering wheel, see if I could lightly pull up and down, almost like a small pumping motion, but keeping it in a range and depth where I don't lose the suction. And if you do, say if you pulled too hard and it popped off, you would just stick it back down and start again. And if you feel like the area starts to get a little bit more elastic, easier to maintain that suction grip on, then you could go back to gliding. So I'm going to say that area had loosened up. I'm going to start back up on my rib cage and then glide down over the right side of my rectus abdominis again. And say this time I note that it doesn't come off as easily next to my belly button. Okay, and then you'd repeat it on the other side of your rectus abdominis area. Okay, I'm just going to put a little bit more lotion on my right hip flexor area because it's probably soaked in. I'm going to focus on showing you things on my right side just because you can see it better on camera. But obviously you'd want to do this on both sides or focus on the side that your therapist had pointed out as needing some extra attention. Okay. You're going to start at the top of your pelvic crest. So find your natural waistline and press in with the side of your hand until you can feel a bony ridge. I'm going to compress the cup. Press it into your skin just on top of that bony ridge. Then once you can see or feel that that suction has happened, then you're going to glide it around the rim of your pelvis and down towards your groin line. You can pause along the way and pull lightly upwards, especially along the groin line, if that's a place that you tend to get very tight and congested, or your therapist has pointed out that there might be some nerve entrapment there. And then once you feel like you've spot treated a few places that are tight with that upward pulling and pumping motion, you could return to a gliding motion around the rim of your pelvis. At home, especially if you need to treat your groin area, it would be best to be undressed below the waist so you could actually cross over that groin line as you're gliding downwards with the cup. Now let's go over gliding around the bladder. So again, I'm just putting on a little bit more lotion because it probably soaked in. So remember, your bladder sits at the brim of your pelvis, right near your pubic bone. So I'm just a couple fingers above my pubic bone here. I'm going to compress the cup, stick it down on towards one side of my pubic bone. I'm just choosing to start on the right. Test that I have that suction that has gripped the skin. And then I'm going to pull upwards, but still trying to maintain the suction, and glide it over my bladder and lower abdominal wall. Okay. If the suction's maintaining well, you can glide back and forth. Or if you find that it keeps popping off, you just pause, put it back on. Again, if there's that spot that repeatedly keeps popping off, that may be a spot that you want to pause and gradually rotate it like a little wheel, slow and smooth, pump up and down a little bit until you feel like it's getting more elastic, just less resistance to movement. And then you could go back to gliding. Finally, you can also use cupping to trace your digestive system to help encourage better motility. This can either be done starting at the end of the system or going from the beginning to the end of the system. Today, I'm going to show you how to start at the end and work backwards through the system, just because sometimes clearing any traffic jams at the end of the system can be beneficial before encouraging more movement of stool through the system. So I'm going to start at the end of my descending colon. So that's on the left side between the bony point in the front of my left pelvis and the midline of my abdomen under my belly button. Okay, so I'm going to squeeze the cup, stick it down on the skin, that left front of the pelvis, and glide inwards towards midline. Okay, this time I'm going to choose to take it off after that stroke and stick it back down on the left, and then glide back to midline and release. Your therapist can give you more specific individualized instructions, but I'd repeat this at least 5 to 10 times in each place that we're going to treat. Okay. When I want to release it, I'm just squeezing it a little bit, and that makes the suction let go. Next, we're going to stroke down the left side from the rib cage to the top of the pelvis. Feel free to apply more lotion at any time if you need to. So squeeze the cup, stick it down just under the left rib cage, let it suction the skin, and then glide it down the left side. Again, this time I'm going to choose to release the suction and start over just under my rib cage. Again, to release it, I'm just squeezing it. Okay. just for demonstration purposes, I'm going a little bit on the fast side, but you could stay on each of these spots for longer, especially if there's an area that feels hard to suction and your therapist has told you is restricted. Next, I'm going to move from the midline of my rib cage along the left side of my rib cage. So I'm squeezing it, sticking it down where my ribs meet in the front, letting it suction, and then gliding it to the left. I'm lightly pulling outwards to help pull that skin and fascia upwards, helping to create mobility and space internally. Okay, so after doing that left side about 5 to 10 times, I treat from left to right across or underneath the right side of my rib cage. This upper abdomen area is going to help, treatment of this upper abdominal area is going to help to treat tightness in the diaphragm fascia as well as the transverse colon. Okay, so now I'm going to go under the right side of my rib cage, suction up the skin, and then pulling outwards just a little bit, glide towards the center where my ribs meet in the middle. Okay, and this time I'm choosing to release the suction and then replace it. Okay, after doing that area about 5 to 10 times, I'm going to come up my right side from the crest of my pelvis up to my rib cage. So I'm squeezing the cup, pressing it into my skin. Once I've got that suction, then I'm going to glide upwards. And again, I'm choosing once I reach the rib cage to intentionally release the suction and start over. Okay, after doing strokes up the right side 5 to 10 times, I'm going to treat from my belly button to the front of the right side of the pelvis. Okay, so I'm just to the right of the belly button. I'm going to pick up the skin with suction and then glide to the right front of my pelvis. Squeeze, pick up the fascia, and glide to the right. See there, it popped off. So say if that happened repetitively, that might be a spot that I choose to spot treat. So I'm suctioning, then I might stay there, wiggle and turn a little bit, grab it again, gently pump up and down, trying to increase the elasticity of those layers of skin and fascia. Okay. After doing that spot 5 to 10 times, I'm going to do circles around the belly button to capture some of my small intestines. So I've picked up the skin. I'm going to try to maintain the suction and go slowly around my belly button. I need just a little bit more lotion because my skin got a little dry. So I'm resuctioning and then trying to keep that suction as I glide around. And for me in my midline, the suction came off, so that might be a spot that I need to spot treat. So I'm pausing there, resuctioning, and then gently pulling outwards, trying to increase the elasticity in those layers of skin and fascia. Okay, as you feel like you've gained more mobility, then again, you could move on with slow gliding circles. Have fun getting to try out some different uses of your silicone cup and ask your therapist for more personalized recommendations.